Hi everyone, welcome to my live session today. I have with me Dr. Shamsul Iskandar bin Hussein. He's our consultant orthopedic surgeon from Damansara. And just give me a moment, let me try and add him in. Oops. Hi everyone. Sorry, just trying to add Dr. Shamsul in. Hi Dr. Shamsul.
Hello, Dr. Rakhee. How are you? Good?
Welcome to my live session. It's so
Oh,
good to have you.
wonderful. Thank you for inviting me.
No worries, no worries. So, Dr. Samsul is my personal as well as my family's orthopedic surgeon as well. So I'll let him introduce himself. Dr. Samsul, go ahead.
Right. Okay, first thing, thank you again to Rakhee for inviting me for this special occasion. Right, you look good. Anyway,
Thank you.
anyway, I'm Dr. Shamsul Iskandar Hussein. I'm the resident consultant orthopedic surgeon. With special interest in sports, orthopedic surgery, and arthroscopy. Well, my main specialty or my specialist degrees in orthopedic surgery from University Malaya, and following which I continued my training in Technical University of Munich in Germany, and also in the Royal Armed Forces of Malaysia for the sports injury and arthroscopic surgical training and practice. And now I've been with Damansara for the past, I guess, 7 years. Wow, such a short time with Ara and you, Rakhee.
Time flew by.
Yeah, yes.
Yeah, time flew by. I don't even realize it.
Yeah,
So it's almost 8 years.
yeah.
Yeah.
So you've been my
Wow.
neighbors for
Amazing.
7, 8 years in Ara.
Yes, yeah, we're actually neighbors in clinic.
Right.
So if you come and see me in clinic, Dr. Samso's right next door,
Okay.
which makes him my favorite orthopedic guy to go to if I ever need any problems. All right, I'm gonna ask you a couple of questions that
Sure,
I've
sure.
had asked by some of my followers,
Right.
and we'll go through them. If anybody else has any questions, do put them up in the comment section, and we'll answer them as best as we can. So during the lockdown period, what can we actually do to maintain our fitness or stamina? What would you recommend as type of exercises? Because we know that the current lockdown, we're not allowed to cycle. But besides that, what are the other things that we can actually do to maintain our fitness?
Okay. So I think everyone has been sort of stressed or been traumatized either physically or mentally with the current situation, and we'll try to make the best of it. Well, during this lockdown, definitely we have limited gym access or being involved in our own fitness group, our own fitness team, aerobics, or even, in fact, going swimming to the public or community pool. Nonetheless, exercise actually is the most powerful, what do you call, most powerful tool to keep us mentally and physically healthy. Okay, so that's why it is recommended, irrespective of the situation, whether we are locked down, whether we are being kept with access to, although we are in lockdown, but we have access to outdoors or indoors, we are encouraged to continue doing our home tailored exercises or our programs, which is basically comfortable to our needs. Okay. Nonetheless, again, medically also, if we if we exercise, actually it will ease any sorts of depression, stress, or in fact anxiety. And clinically also, it actually helps with control of blood pressure, hypertension, and also diabetes. That's actually based on these studies being done. Okay, so in a way, by doing exercise, actually you can retain your sense of self-control or physical health by doing all these exercises. So coming to your question, lockdown period, right? What we can do, and what sort of exercise, if I remember the question, yeah. So
Yes,
we,
what kind of
yeah.
exercises?
So first things first. Actually, when you want to exercise, you cannot just do impromptu. You can't just finish the whole lots of your Netflix. You watch what do you call? You watch all the Korean K-pops, or you watch your Game of Thrones series, then only you want to exercise because you have nothing else to do. You can't do that. You have to plan, in the sense that you want to plan what is your program, what is your intention of your exercising. Either you want to control your weight, you want to improve your stamina, or you want to be flexible. So all these things actually requires planning. It's not just that, okay, I have 10 minutes before going to the bathroom, or I have 5 minutes before going preparing the dishes or anything like that. So you have to plan it accordingly. Just like when you during the non-lockdown days where you have times to go for your gym or for your swim, same goes for your current lockdown exercises. So first thing is that you must prioritize. Okay, so once you prioritize, then you'll be more motivated, or you're more inclined to continue your regular exercises. Next is actually the timing of your workout. Some people will do like they will wake up very early in the morning. They wake up early around 4 or 5 in the morning. Then they start their early morning run. This is like people studies early in the morning. Same goes for people who exercise early in the morning, whether they go to the gym or they go for the run. Well, we have our resident spine surgeon, our Apek Pacer, also he does very early morning runs and swim. Okay, so
Yes.
but
Yeah.
some people, probably most of us, we always tend to exercise later in the evening. Once you finish our work, our chores, or our family duties,
Yeah.
then you decide which is actually most applicable for you. Then you'll be more inclined, or you're more disciplined with your exercises. All right. So again,
Yeah.
like I've mentioned earlier, you must have specific goals. Either you want to more of a strength training, or you want to do more of your stamina. So all this will differ in type of exercises that you do. All right. Okay.
Okay.
So and then furthermore, okay, and the type of exercises. I think to continue with Dr. Rakhee's question, the type of exercises, we can in general, type of exercises depends on the type of the physical activity. You have one is the endurance exercises, where something like, for example, you do swim for laps of swim, or you even do jogging for a few kilometers. This is actually to build up stamina. Okay, so this is some of the examples. There's a lot of other things also, but this is the common things that being done. And then you have the strength training. So strength training is like people who carry weights, go to the gym, you have your own barbells or dumbbells, or even you fill up bottled water. You carry bottled water, you can do that. Along with even do like some all those exercises without any equipments, like you do your push-up, wall push-ups, counter push-ups, floor push-ups. So this is depending upon the your strength
Body
itself.
strength.
Okay. Then you have the third one. They call it the balance exercise. Balance exercise means more for proprioception, or for the balancing. So this is like when you stand on a single leg, just something like a yoga pose, or those are some of the exercises, or something which is more more challenging. Probably you'll be standing on a mini trampoline, standing one leg, or even if possible, then you can. But if not, then you use two legs. Okay, so that is considered as the balance exercise. Finally, you have the flexible.
So that would also be something when you use the balance ball, you know,
Yes,
the
yes, you
balance
get the
ball,
half
and
balance ball.
also similar to that.
Correct, correct. So it all depends on your availability and your requirements. And next, actually, you have the fourth one, which is actually the flexibility exercise. I think flexible, as you know, as you mean in yoga, or some people, Tai Chi, those are flexible. So, so this is all the types of exercises that you do. Okay. And depending upon what you choose for, meaning whether you want to become strong, or you want to have more stamina, or you want to have more flexibility, and finally you want to do more on the balancing. You want to have more balanced posture or body. You can do or perform the exercise accordingly, right?
Okay, so you basically choose the exercise that is more suited to yourself and what your target is, and then you go for that.
Yes.
And of course, you don't jump into an exercise suddenly. You need your stretches before and after, and things like that.
Definitely.
So like I went on a whole fitness routine last year. You know that, right?
Yeah, you go.
So when I did all of that, so yeah, go. So what happened is, of course, there were a lot of injuries sustained in between here and there. So what are the common type of injuries that you see during this pandemic, especially, you know, when all of us from sitting in the couch, being couch potatoes, decide, oh no, I better start doing some exercises. And, you know, we suddenly jump and start running, or we suddenly start lifting weights. So what are the kind of injuries that you've been seeing in this past year or so?
Well, interesting, Rakhee, because when you have this lockdown situation, you have the so-called injuries due to lack of activity or inactivity, and second, injuries because of sudden resumption of return to vigorous or strenuous activity. Okay, so I think being clinician,
I never knew I could injure myself sitting down and doing nothing.
Oh, of course you can. Well, being a couch potato, probably we exercise our mouth, our throat, or in fact our eyes at the most.
Yeah.
All right, but I think it's quite common from the patients that came to see me and seek consultation. First things that they will have is actually due to the lack of activity is low back pain. Okay, because of poor posture, lack of exercise, poor weak core strength, and then probably nowadays people tend to work from home. When not regularly or normally you work in office, you have ergonomics desk, you have ergonomic chairs, and you have specific time to go to work and to return. And like nowadays, in lockdowns, you work on your sitting on your dining chair, on dining table. You work for hours and hours. You are replying your emails. You have your endless hours of meetings, and then you just forget about other things. And by the time the person realizes it, they will start to have this back pains. They have so-called stiffness, and then besides low back pain, they will also have neck pain. Neck pain, where person will have stiff neck, or sometimes leading up to headache, in fact shoulder pain, which comes together with the neck or in isolated problems, all because of lack of exercise, poor posture, and then due to prolonged so-called prolonged work. Okay, so this prolonged working activities, not even physical activities, it's just the work activities. So for this reason, actually people come to see me while they are working from home, or not even from the exercise. It's due to in fact it's due to lack of exercise. Okay, and next so you know I like to talk. So anyway, now comes the sudden injuries due to the sudden return to your previous activities. So this usually occurs to people who have been regularly running on the roads, or have been a so-called frequent runner, or frequent sportsmen, not even weekend warriors. But because of this lockdown, they totally stopped everything for a few months. Or now it's been more than 1 year. So when this happens, suddenly they return to the normal rigorous strenuous activities. Like before this, they were playing high intensity tennis, or they were playing high intensity badminton. Suddenly, they just go to the court and start smashing all the way, just like Kirsona, all these our new champions. So and then they realize after that they've torn something, or they've injured themselves. Okay, that's one. That's the shoulder pain. Next, they will have knee pain. Knee pain occurring usually for people who've been stopped running for the past few months, or been running very less or minimal, plus people who have been cycling. All right, so previously the muscles are very strong, and they are basically they've been regularly stretching, they've been warming up, they have enough nutrition. So then all of a sudden once the gates has been opened up, they just return to their activities, and this actually can cause injuries to the knees, such as cartilage injury, the so-called the cushion of the knee injury, which is called the meniscus, and sometimes sometimes in worse situations they tore their ligaments. So this can happen, and besides that,
this can also happen to people people with futsal, who are like futsal players,
Yes,
football
yes, yeah.
players?
So this normally regularly happens. I'll see this kind of patients with ACL injury during futsal games, but nowadays is because of lack of activity, because of the weak leg muscles, then that can also still happen. There's a lot. There are other
Okay.
injuries. Examples, other injuries is actually the thigh muscle, the hamstring. Yeah? Again, because lack of exercise, lack of stretching, and then suddenly they just burst, running all over just to get out from the house. And now you can still
Yeah.
run within the 10-kilometer radius of your
Yes,
house. You
yes.
can still run. So there's the tendency that you may actually tear your hamstring,
Yeah.
or in fact, sometimes the calf muscle, the gastrocnemius muscle. This can also
Oh,
happen, the calf muscle strain. Okay, and sometimes also in certain incidences, or in some unfortunate sportsmen, there's higher chances or higher frequency of ankle sprain. Again, because
ankle.
ankle sprain and ligament injury. This is all because
Okay.
sometimes because of the lockdown, you haven't been running regularly, your muscle hasn't been really that strong, and all of a sudden, because of this ease of the lockdown, ease of the MCO, then people start running and they want to run as much as possible, as fast as possible, and
Yeah.
probably Malaysia being blessed with either sudden rain or sudden sunny weather. So when they are running outdoors during a sunny weather, suddenly when there's a heavy pour, then they try to have a what do you call a longer stride, a quicker run, which actually can
Oh.
so-called tear their muscles, or in fact they may sprain
Oh.
their ankle because of the slippery roads, right? So in a way, although during this MCO, probably there's a lot, I see less patients who are coming from sports related injuries from futsal from the football grounds, but I do see patients who are coming from these kind of injuries actually. Yeah.
Okay. So what can we actually do to prevent that sort of injury?
I see. So most important, if you want to prevent injuries prevention for ourselves, for adults, first things we have to
Yeah.
go slow. We have to take things gradually. In
Okay.
sense that you have to do your warming up, you have to do your stretches, your strengthening. This actually you can do at home while
Yeah.
indoors, while before going for your run. You can actually do all this. You can actually do. I think you're quite familiar, right? When you do your static running or static or you do your stretching, but most
Yeah.
important is that we have to remember doing it,
Okay.
so that this will avoid us from getting any injuries.
Okay, so warming up and warming down is very
Of course,
important.
yes.
And how long would you say is enough to, like, for us to warm up or warm down? 2 to 3 minutes, or
Well,
more like 5 to 10 minutes?
yes, I think it takes at least up to 5 to 10 minutes. Even
Okay. All right.
you can't. This is especially true when you're going for strenuous activities. Okay, it means that
Okay.
when you want to go for 30 minutes or 40 or 1 hour run, so this is actually
Okay.
important. But if you are doing those
Okay.
short exercises, like you are doing like 30 minutes of exercise 5 times a day, that's really a
Okay.
regular exercise. So you just need a 5 minutes warming up or
2 3 minutes.
stretches. Yeah,
Okay.
it all depends on
All right.
how regular you are doing your exercise in a week. Mm.
I see. I see. Okay. So now, when you talk about warming up, warming down,
Yeah,
and going for exercises, what about in between? Like, so if you're going for, this is just for my personal,
yeah,
if you go for a long run, just say,
yes.
does it make a difference whether you're doing a walk, a jog, or a run, that you need to do the warm up before and after? For all three, you need to do, isn't it? If you go for just a brisk walk,
Mm-hmm.
or you're going for a jog, and definitely for a run. But what
Yes.
about the walks? And like the old people, the aunties and uncles around the neighborhood, they do their evening walks. By right, they should also do a warm up, warm down.
If their so-called their intensity is so-called is not really high, not really strenuous intensity. I think just more like a
Okay.
casual walk. It's like on
Yeah.
a walk after dinner, after a meal.
Yes.
So you don't really have to, yeah, unless
Okay.
especially when you are doing it on a regular basis. Only if that you are doing
Oh,
like
okay.
once in a blue moon, suddenly you want to walk 2 or 3 kilometers after a meal,
Yeah.
then I think you
Yeah.
have to be careful because this is something that you are not used to, and then suddenly you want to walk for quite a duration. Probably
Okay.
one thing that will be affected is most likely is the stamina. It's not really the injury, but
Stamina.
you may feel
Okay.
out of breath or something like that.
Okay. All right. So I'm going to ask you a question with regards to the COVID-19 vaccine. So like
Okay, yeah,
you see a lot of patients who have joint procedures. Like you said, if they have a meniscal injury
right,
or maybe they're osteoarthritic,
yeah,
they have wear and tear usage of any joint. So they need some sort of surgery or a procedure done.
correct.
Does this sort of, can these patients get the COVID-19 vaccine? Do they have to be concerned about their procedures or?
Well, yeah. Now, thank God that we already have access to COVID vaccines. It's only actually
Yep.
is a matter of time or when are we getting it. For us,
Okay.
health personnel, we already got it because we are a high risk group.
Yep.
We are exposed to patients. So for the people, right? For common people like
General
the
population.
general
Yeah.
population, well, it's always advised that you should get the vaccine as soon as possible. And the best vaccine is the ones which is available to you at this moment. So any
Okay.
vaccines available, just grab it because that actually not only saves lives of ourselves, but also to our family. And if we do get infected, the so-called the intensity of the infection, the severity is actually lessened. So with regards to if a person who has injury, like sudden had a fall and then has to undergo the keyhole knee surgery, which we call it as
Yeah.
arthroscopy. If there's a meniscus
Mm-hmm.
tear, which requires a repair or treatment, then once the person undergoes that procedure or the surgery, it's actually advisable for him or her to wait at least for 1 week. Then only for him or for her to undergo the vaccine injections. So there's actually a
Okay.
spacing, because the reason why
Okay.
is that we want to make sure that if there's any pain which develop following the surgery, within 1 week, the pain from the surgery should have abated or would have subsided. And so if there's any symptoms or side effects due to the injection of the vaccine, we can actually safely say that that's mainly due to the vaccine, not really from the surgery. So that's actually the
Okay.
best timeline. I would say minimum 1 week. Okay, and
Week. All right.
this is in situations where the person cannot avoid or delay his or her surgery,
Surgery.
right?
Okay. And of course, if you do get, like if you have a shoulder injury and you
Yes.
have your procedure done there,
Mhm.
preferably to get the vaccine on the opposite arm, right?
Yes, of course. Yeah, because again,
Yeah.
when a person undergoes a surgery procedure, it's sometimes based on the quality of the tissue and the rate of recovery of the person himself or herself. It
Yeah.
takes probably longer. It takes sometimes it's not only weeks, sometimes months for the pain to really disappear.
For the recovery.
Yeah. So of
Okay.
course, if you undergo the surgery on the right side, I will always advise my patient to get the vaccination done on the opposite side.
The opposite.
Yeah.
All right. So what about patients who are going for bigger procedures? Like I know a few of my neighbors that go for knee
Okay.
replacement surgery. So
Right.
like, total knee
Yeah.
replacement, big stuff. This is not
Right.
just a keyhole surgery. This
Correct.
is taking out whole joint and putting it in. So what about big procedures like
Right.
that? Knee replacements or hip replacements.
Correct.
How long do they need to wait
Right.
for the COVID vaccine?
Well, interesting enough. So, based on the studies or based on journals that has been published, one of them being Journal British of Joint Surgery, JBJS. So the authors
Okay.
has recommended that before a person undergoes this kind of surgery, hip joint replacement surgery, it's always advisable to get the vaccine done, get the vaccination first, because usually the person who undergoes this kind of joint replacement surgery, total joint replacement surgery, they are usually elderly. And study has shown that this group of patients, there's a higher tendency also to get the infection or to have complications if they get COVID-19 infection following this total joint surgery. And if they do if they do get this infection, COVID-19 infection, there's a greater risk of them dying. And this is actually based on the study, which is, I think was done in Australia, but it's a combination of multiple centers, which has been published in the JBJS. So that's why, if possible, get your vaccine first. Get the vaccination done, and then, if possible, because all these joint replacement surgeries usually is an elective, which is a planned surgery, meaning that in an optimal period, that will be then it's best recommended to undergo the surgery. If not, there are always other means to control the pain for the time being, right? Right from taking oral painkillers, getting injections or painkiller to the buttock or inside the joint itself, or undergoing physiotherapy. Those actually will help. If not permanently, can be temporarily. All right. And then if once situation prevails or situation permits, like if the person has undergone COVID vaccine, or there's a good herd immunity, probably we need more than 70% or 80%, then that would be the best time for a person to undergo total joint replacement. This is not my own belief, but this is actually based on studies.
Okay. So basically, if they're also going, it'll be good for the family members also to get vaccinated, so that if they do during their recovery, so they can even come and visit, because you don't want an old person in recovery from a huge surgery to be exposed to somebody who's not vaccinated and the possibility of them getting.
But for the time being now, also the hospital does not permit visitors or basically relatives.
And what I mean is at home.
Oh yeah.
Yeah, most hospitals don't allow visitors, including ours.
Yeah.
So at home, like once you're recovering at home also, when your family members come to visit, hey, how's your knee? How's your hip? How's your new knee? So all that, you don't want a whole bunch of people coming and visiting you post-surgery when you're still considered high risk. Even though you're vaccinated, but you're, like just today, there was news in the paper today that there was a 60-year-old man in Sabah. The family threw a birthday party for him and gave him COVID. So, like somebody from the party got COVID. So, you don't want to give someone a gift of an infection. You want to give them the gift of life. So, so I think it's best if everybody around that patient as well gets themselves vaccinated, or don't visit until you feel the patient has recovered. So any tips, Dr. Shamsul, that you have to stay fit and healthy during this pandemic or during these multiple lockdowns that we're having? I'm going to lose count on the number of lockdowns we're having. But any tips for us to stay fit and healthy?
Sure. Yeah. So the first things, it's all being healthy. One of the ways is actually through our stomach, which means that we should have balanced and healthy diet. Yeah, it's not only a matter of snacking or eating chips while watching TVs or watching the programs. While also working, but we must balance our diet. Nowadays, I think the current trend is the what you call quarter and half. You know that?
Yes.
Yeah. Quarter fruits or vegetables, and then a quarter of protein. Quarter of fat, and then quarter of protein, and then half, which is comprising of fruits and vegetables.
Yeah.
Sorry, the other quarter should be the carbs. I missed the carbs. Carbs quarter.
Don't worry. I've got a dietitian coming in next week to talk about it. So don't worry.
All right. Okay.
So basically, suku sparrow or quarter half.
Yeah.
You can look it up on the KKM website as well on a healthier diet. It's no more eating a whole bunch of carbohydrates. I think the food pyramid has gone out the window for quite some time.
So it's an
besides
evolution.
Food, what else can we do?
Okay. Next is actually. How do you want to? What you do is also besides the food. Drink plenty of plain water. I think with Malaysian weather, it's hot, so we tend to feel dehydrated or dry. So we need to basically consume a lot of plain water, And furthermore, being Malaysians, I think we love to be in the air conditioning place.
Yeah.
Again,
Very dry.
that's a cause, a reason for our body to become dry. So you need to drink lots of
Yeah.
plain water. You can drink a bit of coffee or the rest of drinks, but most important is to keep ourselves water hydrated. And how do you know that you are drinking enough? Your urine. So you have a clear urine, means that you are not too concentrated. I think that's very simple. Right. Next is actually you can do if you want to focus on the exercises. Of course, some of us does not have the benefit of proper time to do the exercise. We can actually intersperse the exercise. Well, in between, like when you are doing the household chores, you can actually while you are washing your plates, you can do a bit of your exercises, a bit of running in between. Okay, or you can do some lightweight training. You can do push-ups, wall push-ups. So you can, in between the household chores, you can actually do some of the activities, like while you're doing your laundry. Well, you can think of something, but otherwise, that's one of the way. Next is actually, if you are receiving a call from the phone, like for us, probably we are on call. But what I meant is that when you're on the phone, while you're answering the colleagues or you're on conversation on the phone, you can actually do some movement activities. You can do some static on the spot running, jumping or jogging. So you can keep yourself active at the time, right? And thirdly, the other thing, what they call is the microwave exercise. You know what's microwave exercise? So while waiting, so while you're reheating your food, I don't think you reheat your food. You always make fresh foods, right? Fresh. You always cook. You always cook fresh. But this is probably to those to the single guys or single guys.
No, but I do reheat my hot drinks though. So so I do use the microwave.
So when you use the microwave,
what can I do?
So within that 15 to 20 or 30 seconds, you can do the so-called table push-ups, wall push-ups, the countertop push-ups. So you still have time actually. So that 30 seconds actually time is money, right? So you can utilize that to do some of those activities. And I know you, Rakhee, that you love to exercise. So I know that you can find time and place to do it.
I will do it. I'll definitely look up the microwave exercises for sure.
So they call it the microwave exercise is a short burst movements. So within that 30 seconds, then you do all out. So that by the time the microwave rings, ding, you can take you're already done with your exercise, then you can pick up your mark. So so these are some of the tips. So actually, there's a lot of things that we can actually do. It's a matter of us
wanting to do it.
Correct. Yeah. So we have our goals, our aim, our plan. So each of us, or all of us, can do it, irrespective of the time, place, and also situation. All right.
I think it's just mind over matter. As long as you put your mind to it, you'll be able to do it.
Of course.
Thank you so much, Dr. Shamsul. I think this has been really an eye-opening session with me as well. So if anybody has just joined and missed the first few minutes, do look up. Dr. Shamsul will be on my IGTV as well as my YouTube channel. So if anybody missed any parts of all his excellent advice on how to keep fit and what to do if you're going for knee replacements, or what to do if your auntie uncles are going for huge surgeries or whatever, and the COVID vaccine, do look us up on IGTV. And Dr. Shamsul, thank you so much. This has been absolutely wonderful.
Thank you for your invitation.
No problem. Take care.
Bye bye. You too. Okay. See you tomorrow.
See you tomorrow. Bye.
Bye.
Bye.